Hi, everyone. My name is Michelle Valley. I was asked by your professor to speak to you about the future of nursing. I am a family nurse practitioner and I own my own primary care practice here in Connecticut. One service that my practice offers is medical marijuana certifications, education, and consultations. I fell into this area by the request of my patients. This is a great example of one of the changes we will all be seeing in the future of nursing. As marijuana becomes legalized, more research has been allowed, which has provided evidence that marijuana may help certain medical conditions. 2 years ago, there were 17 diagnoses listed in Connecticut that were proven to benefit from medical marijuana. The list now has 42 qualifying medical conditions on it. The healthcare world is in a unique position right now with medical marijuana. We have a lot of patients who are currently using it or interested in using it, yet there has been no formal training in the current medical or nursing curriculum, although that is going to change soon. NCLEX is doing a major revision on their content as we speak, and they will be adding questions about medical marijuana within the next few years. This will force nursing programs to include it in the curriculum in order to prepare their students to pass the boards. This leaves a lot of potential for us as nurses. There are certificate and degree programs popping up throughout the country for providers interested in medical marijuana. I personally completed a 10-month certificate program. It was online through Pacific College, and I now have the title of Certified Cannabis Practitioner. This was not required to certify patients to use medical marijuana. However, I personally felt that I wanted to learn more and be able to better care for my patients and answer their questions. CBD, I'm sure you've heard of it. It is legal. CBD is a component of the marijuana plant. It does not cross the blood brain barrier, therefore, not causing impairment like the other part of the marijuana plant, which is known as THC. CBD binds to many receptors in our endocannabinoid system. This endocannabinoid system was recently discovered in the 1980s, and it's responsible for a lot, our body's homeostasis. That means temperature regulation, pain receptors, inflammation, stress levels. Often, our endocannabinoid systems are upregulated or downregulated. In other words, not balanced. And that is leading to many of the chronic conditions that we see today. One big reason that our endocannabinoid systems are not balanced is because hemp is no longer part of our diet. Hemp is a plant that became outlawed when cannabis did. And for a long time, hemp was farmed and consumed in a big part of the human diet. CBD does a lot of biological changes within our body to restore the balance, again, without causing the impairment that THC does. Because it does not contain THC, CBD has become legal and is able now to be sold anywhere. This is a big opportunity for nurses on both the business end and as healthcare professionals and educators. One thing to keep in mind is the quality of CBD. These products are not FDA approved, and there is no quality control for the most part. However, there are certificates of analysis that manufacturers can purchase, which is a lab test proving that the ingredients in the product are what they say they are. In order to be sold at a medical dispensary, a certificate of analysis needs to be done on all products. Therefore, I usually suggest that someone buys from a medical dispensary whenever possible so they know what they're getting. In order to do that in Connecticut, you need a medical marijuana card. To get a medical marijuana card, You need to have a qualifying medical condition, which is one of those 42 conditions that I mentioned earlier. A physician, physician's assistant, or nurse practitioner can certify a patient to get a medical card. What can a registered nurse do in this world of medical marijuana? A registered nurse can provide education on the topic to patients. They can work with schools to update their curriculums to include medical marijuana. They could even start their own CBD businesses selling CBD. They can write books, start a blog. There is so much education and reliable resources that need to be developed as more people are participating in this type of treatment. So I hope that I gave you a taste of what's coming down the road, regardless of how involved you want to be in the medical marijuana world. You will encounter patients that use it, and you will need to be aware of it to some extent. So I hope you enjoyed this presentation. I will give your professor my contact information, and you could reach out to me at any time with any questions. Best of luck in the future, nurses.